Welcome to the Myeloma Matters podcast, hosted by the Multiple Myeloma Research Foundation, focusing on patients' experiences and perspectives on multiple myeloma topics that matter to anyone affected by this blood cancer. In this episode, you'll learn about smoldering multiple myeloma, a condition that can precede a multiple myeloma diagnosis. You'll learn how smoldering myeloma is diagnosed, how it's different than active multiple myeloma, and what its standard of care is. You'll also hear from two patients who share their stories about how they stay on top of their smoldering myeloma. Please note that every myeloma patient is unique. The information in this podcast is not intended to replace the services or advice of trained healthcare professionals. Please consult with your healthcare team or contact the MMRF Patient Navigation Center at 1-888-841-6673 if you have specific questions about your health. If you'd like to support this podcast series, we'd love for you to leave a comment or review wherever you get your podcasts. Smoldering myeloma is a stage of disease that in some cases develops into active multiple myeloma. Smoldering myeloma is similar to active multiple myeloma in that there's an increased number of abnormal plasma cells in the bone marrow. Plasma cells are cells in the immune system that produce antibodies. In smoldering myeloma, plasma cells become abnormal and produce M protein, which is an abnormal antibody. In people with smoldering myeloma, M protein and free light chains, which are the shorter of the two protein chains that make up an antibody, characterized as either kappa or lambda type, can typically be detected in the blood or urine. People with smoldering myeloma do not have any of the symptoms commonly associated with active multiple myeloma, such as anemia, kidney problems, or bone damage. People who have smoldering myeloma are at increased risk of developing active myeloma. As the name implies, though, smoldering myeloma can last months or even years before progressing to active multiple myeloma. However, some patients develop active myeloma soon after their smoldering myeloma diagnosis is made. The course of smoldering myeloma is different for each person. A variety of tests may be performed to confirm a diagnosis of smoldering myeloma, including blood, urine, bone marrow, and imaging tests. People with smoldering myeloma typically have lower levels of M protein in the blood or urine than do patients with active multiple myeloma. They also have a lower percentage of plasma cells in the bone marrow, typically between 10% and 60%. Another defining feature of smoldering myeloma is the absence of the clinical features associated with active multiple myeloma, known as the CRAB criteria. CRAB is an acronym that describes the signs and symptoms typically observed with active myeloma. C stands for calcium. People with active myeloma often have elevated levels of calcium that can be detected in the blood. R stands for renal or kidney problems. The A stands for anemia, which is a decrease in the number of red blood cells. B stands for bone symptoms, which may include fractures or lesions. The absence of any of these signs and symptoms is one of the defining characteristics of smoldering myeloma. After or while a diagnosis is being made, it's important for individuals with smoldering myeloma to see a myeloma specialist to confirm their diagnosis and develop a care plan. One thing a myeloma specialist can help with is assessing the risk of progression from smoldering to active myeloma. Every case of smoldering myeloma is different, and it can be difficult to assess the trajectory of the disease, but there are some features that can increase the likelihood of developing active myeloma more quickly. In general, smoldering myeloma is characterized as high risk, based on the presence of two or more risk factors, which can be evaluated through blood or bone marrow testing. The standard of care for smoldering myeloma is watchful waiting with regular monitoring. Watchful waiting includes monitoring patients' blood work every 3 to 4 months for levels of M protein, free light chains, blood cells, calcium, and creatinine. After 5 years of monitoring, the interval can be reduced to once every 6 months. Treatment is not usually recommended unless it's done in the context of a clinical study. The frequency of testing to monitor smoldering myeloma depends on a variety of factors, including the risk for progression and where care is being received. As noted, treatment is not recommended for people with smoldering myeloma because there is not yet organ damage or symptoms associated with active disease. Additionally, no more than half of the people with smoldering myeloma progress to active myeloma within 5 years of diagnosis. Because treatment could lead to side effects, the consensus is that the potential risks of early treatment outweigh any potential benefits. In some cases, people may receive treatment in a clinical study. There are 2 types of clinical studies available for people with smoldering myeloma. One type investigates treatments for patients considered to be at high risk for progression to active myeloma. The other type investigates the biology of the disease to better understand how and why smoldering myeloma develops or progresses. Treatment is not typically given in this type of study. The emotional experience of dealing with a smoldering diagnosis can be challenging and confusing. It can be stressful to cope with the uncertainty of the disease. Every new ache or pain and anticipation of the next round of lab results can lead to worry that the disease may be progressing. Now, let's hear more from Jesse and Brooke, who joined the MMRF's Aaron Mensching to further discuss their experiences with smoldering myeloma diagnosis and monitoring.
Hi, Jesse and Brooke. Thank you for joining our podcast and sharing your stories and experiences. We receive so many emails and calls here at the MMRF's Patient Navigation Center about this particular topic, so our discussion is very timely. Most of what people read or hear about smoldering myeloma and what makes it different than multiple myeloma is that there are no specific symptoms associated with having smoldering myeloma. In fact, smoldering myeloma is also known as asymptomatic myeloma. So this brings me to my first question. How did each of you learn that you had smoldering myeloma? And if there are no symptoms, what led you to see your doctor? And Jesse, I'll let you answer this question first.
It is the case that a lot of people who are diagnosed with smoldering myeloma are diagnosed incidentally. For me, that wasn't the case. I experienced a series of repeated chronic respiratory infections that were getting progressively worse over the course of a few years. I would get these infections every 2 to 3 months, and then I started to get a skin infection that was just really horrible. And so that just led to some testing, which led to my diagnosis. So I'm a little bit of, not typical in that sense because my finding wasn't incidental.
And Brooke, did you have a similar experience with your diagnosis?
I was living in South Florida at the time. I was 40 years old, and I had one too many ear infections that led my doctor to investigate a little further, do a little extra blood work, and lo and behold, then send me up to Dana-Farber up in Boston for a bone marrow biopsy and further checking.
So Brooke, let's stay with you for the next question. Did you get a second opinion or find a myeloma specialist to consult with after your diagnosis? Is that when you found Dana-Farber?
My GP sent me to a hematologist locally in Boca Raton. It was then determined that I needed to go to a specialist. I ended up flying up to Boston and going to Dana-Farber because at the time there weren't as many. I think now that there are more in South Florida, but at the time there weren't really any specialists for myeloma in that area.
Jesse, what was your path after your diagnosis? And do you feel that you had the right team caring for you at the time?
I live in South Dakota, and so my local, I was sent to hematology, oncology, and it was then that I was diagnosed with smoldering myeloma. So I started to do my own research and realized that the recommendation was to see a specialist. And so I'm not too far from the Mayo Clinic Rochester, just about 4 hours. And so I talked to my local hematologist about going to Mayo, and he supported that. It didn't come from him. I found that information online and the recommendation that a lot of people had to see a specialist in myeloma, given the complexities of myeloma. And so I initiated that myself.
And so, since we do get this question a lot from people who are newly diagnosed or smoldering, they ask, how does the dynamic work between their local doctor, or maybe the one who discovered or diagnosed? And how does that work when they get a second opinion or a specialist? And do you find, Jesse, that they talk and communicate and sort of are a care team together? Does that seem to work pretty well?
Yeah, I think it does. I mean, I think, the specialist that I see at the Mayo Clinic is open to, obviously sharing and communicating. I think today so much of that just happens online with record sharing. My local oncologist, hematologist, the one I was with when I was diagnosed has left, and so I'm with somebody else. And they're supportive of me seeing someone at Mayo. The statistics show that the typical local oncologist, hematologist has probably less than 5% of their caseload with multiple myeloma, and then smoldering myeloma probably being a smaller percentage of that even. So to be able to get that specialist and expert opinion with someone who is staying on top of the latest research, I think is really important. And I've not had any trouble with any of my local doctors being concerned that I'm working with a specialist. I find it's a good team. I do my quarterly labs, 3 of them locally, and then 1 I go to Mayo. So I'm on kind of a yearly basis with the Mayo Clinic.
So the PNC, the Patient Navigation Center at the MMRF, they do believe in following this right track program because there was an older study that showed that the outcomes are better for people who do go see a specialist rather than staying with a local provider. And as you had mentioned, they often don't have a large percentage of myeloma patients in their general practice.
After being diagnosed in South Florida, I actually moved to Connecticut, and I currently have a local oncologist and then also work with Dr. Richardson up at Dana-Farber. They're very good at communicating with each other. The tough part comes, I think, which happened with me, is that they don't always agree with each other. That can be challenging if you don't get the right team. But I think if you do your own research and you do your own due diligence, you can get a sense of what the best protocol will be for you. And in addition to reaching out to the MMRF as well, because they are an amazing resource for helping to answer some of those questions.
That's really interesting, Brooke. So I was diagnosed in late 2016. About 5 years after that, my local oncologist, my M spike reached 2.0 for the first time. It had varied between 1.4 and 1.9 up and down. It wasn't a steady climb. So I saw it 2.0 before I walked in the office. I wasn't concerned about it. My local oncologist walked in the office, and one of the first things she said was, "It's time to start treatment." And I was like, very respectful. I really like her a lot. She works hard. She's a professional in her field. Who am I? I'm just a patient who doesn't know much, right? But I knew a little bit. And I said, well, I really think we should, pull the specialist in to have this conversation. She was using the 2220 criteria as kind of a framework there, which that framework is an indication of risk of progression within 2 years, not an indication to treat. And so, it created kind of this situation, right, where I felt a little uncomfortable because as the patient, it's my life. But I think this speaks to the importance of patients being educated themselves and then also understanding their risk tolerance. And if they're considering treatment or a clinical trial, making sure that they really understand all the facets of that as well.
I agree. As far as trials and so forth, I was a single mom with 2 kids at home when I moved back to Connecticut. I often was asked to do trials up at Dana-Farber because they specialize and do so many amazing trials. But that really just didn't work with my lifestyle of hauling it back and forth to Boston. And at the time, as Aaron probably knows, I actually worked at the MMRF, and so I sort of felt like that kept me as close to the pulse as I could be. So I felt comfortable with just doing it the way I wanted to do it and working within the parameters that I needed to be. And I was actually diagnosed back in 2010, so it's been a while. So I smoldered for 14 years before starting treatment actually this past January.
So, when you talk about some of those factors, and, you talked about maybe your life circumstances didn't really fit at the time for entering a trial. What do you think are some of the most important factors that a person should consider if they're looking at, considering a clinical trial?
Well, for me and smoldering myeloma, back in 2010, there really wasn't a lot going on in that realm. Obviously, people were focused more on active multiple myeloma, and I was asymptomatic. Still, thankfully, I'm pretty much asymptomatic. It wasn't as much of an option. That the trials just kind of started sort of halfway while I was working at the MMRF. I guess I would have made the choice to do a trial if I were out of options, but for me, I couldn't get up to Boston 3 times a week or whatever it was for the various trials and hold down a job and take care of the kids and so forth. So it would have caused more stress on me to try to do that than not. So I just, doubled down and was even more diligent about making sure that I got to my quarterly blood tests and checked in with my local oncologist, and any variations in my numbers, we would look at and we would talk about. As I said, I did that for 14 years until this past January.
So it's great to hear that you both are take it upon yourself to really gather information. And we talk about patient empowerment, and really to empower yourself is to gather as much knowledge as possible. And what I witness here in the Navigation Center is that it's not always easy having a bunch of experts weigh in with their possibly differing opinions and gathering a lot of information. So to balance that, and as you had mentioned, to understand what treatment options are right for you. Maybe it's not going to be, a clinical trial, or maybe it's not going to be weekly treatment. So to consider all of these is really what makes a person really feel empowered.
I think in smoldering myeloma, the mental aspects aren't addressed that much. It's such a challenge to have this thing that's on the cusp of, what we know the path could be, but you just don't know if you're ever gonna cross over that. Whereas any other type of cancer, the earlier you detect it, the better off you are. And that's just not the case with smoldering myeloma. I mean, yeah, it's good in a sense from a biological perspective, this thing. But in terms of giving patients or people with smoldering myeloma, I don't know if I want to use patients as a describer, but in terms of giving people with smoldering myeloma sort of the tools to deal with this mentally and emotionally, I don't know if we've done a great job with that. And I've heard specialists say that oftentimes their smoldering myeloma patients come to clinic with more anxiety than their active myeloma patients.
The psychological aspect of it is huge. And every time you go into the doctor's office, you wonder, have my numbers changed? Is this going to be the time that they're going to tell me I need to do something differently? And that can take a lot. So you have to also, in my opinion, trust your gut. But then again, keep in mind, I'm the type that will stick their head in the sand and sort of pretend nothing's wrong some of the time, because otherwise it can get overwhelming. And you do have to sort of trust your gut. And I don't over research. I sort of peruse, I guess, and but don't try to get too far deep into the weeds, because whatever you have playing in your head, you will find scarier options out there. And you've got to be able to calm the nerves and not be a victim of being a smoldering myeloma patient. But as we've said, just take control for yourself and get the information that feels right to you, and trust your instincts and trust your doctors. And if you have a question about a diagnosis, or if one doctor is saying one thing and one doctor is saying another, go to another source. And 2 out of 3 ain't bad. And, just keep going until you have the protocol that feels right for you and works for you and your family.
This reminds me of a person that I've been speaking to every 3 months for the past 4 years, and he's in the watchful waiting. There has been a lot of anxiety and trying to balance gathering information, but maybe not too much, and then also finding out how to live your life with joy and happiness in the midst of your waiting. And he did progress, and he was almost relieved, he told me, to start treatment because he said the waiting was just really challenging. So if either of you have any points on what helped, what has helped you, Brooke, maybe during that time to help live life not so focused as a victim, as you said, not so focused as being a patient.
Well, I think for me, I had sort of a unique sort of way of going about it by stumbling in and actually working with the MMRF, but on an event capacity. So I spent 9 years traveling the country and speaking about my smoldering myeloma. And I believe at the time, I don't know if there are any other patients that work there now, but Kathy was the only other patient, when I worked there. I think a cancer diagnosis, whether you're active or not active, the diagnosis itself is super terrifying. And I think you have to then just reassess, and it helps you to realign what's important to you, whether you're active or not. You always have that potential, and it will always be kind of in the back of your mind. So hopefully you're the type of person that takes that information and makes the best out of it and sort of uses it as your superpower to enjoy life and to grab life and to the fullest and to keep moving forward and to keep yourself informed. It's all in the way you look at life and you look at your diagnosis. It never occurred to me that this was going to take me down. I never let that into my head. When I was working at the MMRF, obviously I was surrounded by amazing warriors who put in amazing fights through much worse circumstances than I ever could imagine because things were different 10 years ago. It's all in your perspective and just arming yourself with knowledge and surrounding yourself with people who feed you and fill you up. Stay away from the doubters and the negative people. For me, I tried to have it be a positive as much as I possibly could. Granted, I worked at the MMRF, but at the same time, I didn't tell both my kids until recently because my daughter was very young, and you can't explain it to a young child. So you have to do what works for those that are around you and for what feeds you and help keep you positive. I'm the type that tries to stay positive so that, in my opinion, then more positive outcomes happen.
At this point, being almost 8 years in, I would look at this diagnosis as something that, while I don't want to have it, it has had a positive impact on my life and how I'm moving through the rest of my life. And that wasn't anything that happened overnight. The first, 2, 3, 4 years for me, I had much more anxiety than I do now. It was a roller coaster. It was hard. And I had to work hard to change my perspective and to see that, this is something that, it's not impacting my life today beyond going to get labs, on a regular basis. What can I do that moves me forward in the best sense? And so, I was a workaholic. I reevaluated what's important in life and how can I divide my attention and my priorities appropriately. And then, how can I basically get in the best shape physically, mentally, spiritually now, so that, whatever happens down the road, when I'm strong in whatever facet we're looking at in terms of wellness, that's only going to help me. And then, the other thing that I think is really important, that's been important for me with Smoldering, is when I meet people with active myeloma and I hear their stories and I see what they've been through, I look at that as a vicarious experience that, look at what all these people have done and gone through. And I haven't yet, and hopefully won't, there's that question mark. But if I get there, I can lean on the experience that those people have had already. And I know that they'll be there for me. And so that lends me a great deal of comfort as well.
I completely agree. Taking care of yourself now, mental health, taking care of your physical health, taking care of what you eat, your nutrition, All of that is so important. I think myeloma in many cases is caused environmentally. And if that's if that's one of the issues, how can we, live a cleaner life to help prolong the smoldering or whatever, not progressing. So I think, taking a stab at doing that now is huge. And I actually have a funny, not funny perspective, because somebody asked me not long ago, actually it was my ex-husband, asked me not about a year ago, if you had the choice to do it again, would you want to know that you had smoldering myeloma and go through this for 14 years? Fast forward to March, my ex-husband was also diagnosed with multiple myeloma. And I had just started treatment because I went active, or my numbers were high enough that I had to start treatment in January. And I had always said, yes, I'm glad that I knew, and I'm glad that I was able to manage it. He and I had another conversation a few weeks ago, as he just had a stem cell transplant 2 weeks ago, and I just harvested my stem cells last week, and we had the same conversation again, and he said, I wish I had known a long time ago. He would have liked to know, because then he could have taken better care of himself, and he might not have had to do a stem cell transplant the way he ended up having to do it.
Yeah, so that holistic care that we're talking about, spiritual and mental and psychosocial and all these aspects, are really important, it sounds like. And also reminds me the importance of community and surrounding yourself with people who are warriors and have positive energy and who will cheer you on. And so whether that's joining a support group or finding family members that can cheer you on, there's definitely a lot of emotional support out there that can be super helpful in your community, in a support group. So thank you for bringing that up. That's really important. Were either of you surprised to learn that there is no need to treat your smoldering myeloma?
Right away, when I was diagnosed, I was like, what do you mean you're not going to do anything? Like, are you serious? And then, that's when I learned about clinical trials. I'm like, well, I want a trial. I want to treat this thing. There was this mindset for me of, I need to do something about this. And the sooner I do something, the better it's going to be. But as I learned over time, that's not necessarily the case. I think that treatment is right for some people. I think that researchers are trying to discern who it's right for at this point in time. I appreciate all that work. And I think any smoldering patient who's considering a clinical trial, I hope they really look into, all facets of it, explore their own, tolerance for risk, and make the best decision for them.
And something that we do in the Patient Navigation Center is we provide questions to ask the doctor, because some people they don't know really what to ask to get these good discussions going with their provider. So that's something that we do, and it's one of our most highly downloaded resources on our website, is questions to ask your doctor.
I was just going to say about the last question that you asked. I have found, with all of the myeloma patients I've met over the years, that their families and their caregivers and themselves, they all do feel kind of hopeless or helpless when they're first diagnosed, and getting involved is hugely important. And as I used to do the independent events, so I worked with these amazing patients and their families that would create these events, and it would help them to feel like they weren't just doing nothing, whether it's smoldering or active myeloma. They were gathering their friends and their resources, and being able to contribute to the MMRF that is making such huge strides in finding cures and finding answers and pushing everything in such a better direction. Or you can do a clinical trial, obviously, but there's a variety of things you can do to sort of keep your mental health and make you feel like you are part of the answer, because I think that's a huge piece of it for your own mental health.
So that's great that you both were able to find quality care through various connections and find different means of support. I think it is important to note that individuals with smoldering myeloma shouldn't wait until their disease progresses to multiple myeloma before finding a myeloma specialist and before finding those different avenues of support. And if any of our listeners are unable to find someone, my colleagues and I at the MMRF's Patient Navigation Center can help you find a myeloma specialist. We can also help you find support groups and other means of support. We can be reached by phone at 1-888 841-6673, or by email at patientnavigator@themmrf.org. You can also find this information and a variety of different educational resources on the MMRF's website, www.themmrf.org.
Connected to that, I would add, I'm a myeloma mentor through the MMRF. I'm also a co-leader for Smolder Boulder, a national group for people with smoldering myeloma. So we welcome invite anyone with smoldering myeloma to join us.
We do have people who call and ask if there's specific support groups dedicated for precursor or smoldering myeloma, because they don't necessarily want to be in the room or on a Zoom with people who are actively fighting and on treatment. So I'm so glad that there's these specific support groups.
When we started Smolder Boulder, someone contacted us from one of the medical centers on the East Coast and asked if MGUS was going to be included. We decided not to include MGUS, and they said they were going to start an MGUS group. And so I don't know if that ever happened or not.
They have different groups on Facebook that are dedicated to the different arenas of MGUS and smoldering that used to be run by the MMRF.
We still do. We have some really great Facebook groups that people can go on and they can share their comments and experiences. And then we have the Myeloma Mentor Program, which is terrific. We're so grateful that we have Jesse on that, because we have Smoldering. We have a Caregivers group too, a caregiver mentor. That's been really helpful, because as we know, that's also a challenge for the caregiver.
The online groups, I think, are really good. I do think that sometimes people have to be a little bit discerning of the information that they get from other people who are patients, because I think there, are circumstances or situations where, someone gets on, kind of like XYZ is definitely going to help you and you need to do this and this and this. And it's like, it could help, and I just think that individuals need to not take what they read in those groups as gospel, so to say, and to conduct some, evaluation on their own and talk to their doctors.
Yeah, I think support groups are amazing. I agree that I think they need to support the individual and sort of the emotional aspect of it, but not play doctor and not, pretend to have the right information or the, certainly they can suggest, but there have been so many advances in myeloma in the past 14 years since I was first diagnosed, that it's so important to stay up to date, but also to, as we've been saying, go to a center that specializes in it so that you're getting the most up-to-date information. And people, along the way would be like, oh, have you heard of this? Have you heard of that? Have you tried this? And that tended to make me more nervous. So I tried to get mental support from those around me, but leave the medicine up to the doctors.
Instead of treatment, the standard of care for anyone with smoldering myeloma is watchful waiting, which basically means being frequently monitored by your healthcare team to ensure that you are not progressing to multiple myeloma. So what does frequent monitoring entail exactly? I'd like to give our listeners a window of information into what it's like to have this diagnosis, and specifically, how often did you visit your doctor, or do you visit your doctor, and how long are you there, and maybe what are the tests that they do when you do go?
Yeah, so I have labs done quarterly. Typically, 3 of the 4 quarters I have my labs done locally, and then 1 quarter I go to the Mayo Clinic in Rochester. So my local labs are blood labs. So I live an hour away from the large city where that has the oncologist. So I can go into the local medical center and do labs, and they just give me a window, like, get them done about this week. And then those are posted on my chart. And when I go to the Mayo Clinic, I have scans as well. I've been tested for amyloidosis. I was diagnosed with myocarditis in late 2020, not related to COVID, not related to the vaccine. The vaccine wasn't out yet. And so I've had a heart biopsy at the Mayo Clinic, and so I continue to see cardiology. And so I feel like they do like a comprehensive full picture look when I go there. But locally, blood labs. If, there was a time locally, I mentioned in 2021, where my local oncologist thought it was time to treat, and I contacted my specialist at Mayo. We ended up doing labs then every 6 weeks for about 3 or 4 cycles, kind of rotating between Mayo sending a kid out and then going back to local, and then Mayo sending a kid out. And so, they could look at their numbers compared to the local numbers and get a kind of a closer look. So that's what my experience is. When I first got diagnosed, I had local, more things done locally. Like they did a full body skeletal scan, they did a PET scan, everything. But that's kind of the flow that I've gotten into, or the pattern I've gotten into now.
So the blood work it was done or is being done every quarter, and then with the large center annually, which includes the imaging.
Yes, and sometimes urine analysis.
Okay, now what about for you, Brooke?
So mine a little bit different, probably since I was diagnosed a little longer ago. Same as Jesse, I also would do yearly scans. I didn't do very many bone marrow biopsies, thank goodness. Dana-Farber actually still doesn't knock you out for a bone marrow biopsy, and I don't know if I'm just a huge baby, but that was a huge deal for me. And finally, I realized that Stanford Hospital, where I'm treated locally, does. So I was much happier to do my second bone marrow biopsy, and now I did one last year and then one this year as well. But Dana-Farber tried to get me to do it up at Dana-Farber, and I said no, because I am not going through that again. For me, I'm a needle phobe to this day. So that is what I insisted on. Until January, when I started treatment, my last few years have looked like I probably should have been going to Dana-Farber once a year. I actually stopped going about probably 5 years ago, and then went back as soon as my numbers went up this past December. But I would go and have my blood work done and see my oncologist every quarter for the past 14 years, basically. My local oncologist is still about 30 to 40 minutes away. So I would go and do my blood work, but he would review the last quarter's blood work, so I was always one step behind because of the fact that I didn't want to go twice every quarter, because he wanted to see me every quarter and he wanted me to have blood work every quarter, but I wasn't willing to double down on that. So I would be discussing the big labs, the M-spike, the IgG, those from the quarter before. But he was able to tell through some of the numbers that come up quicker if I were at any immediate risk. And he would call me if anything changed. And he was the same way, where he was like, oh, your numbers are going, we need to do something. And I would reach out to Dana-Farber and then sort of calm things down. And, in December, my numbers shot up high enough that they said even without symptoms, I needed to start treatment. And I went up to Dana-Farber and they agreed. So that is what I did.
And now, was there a bone marrow biopsy once they started seeing your numbers rise? Was that necessary prior to starting treatment?
So before you start treatment, and I did the DRVD treatment starting in January, and which, amazingly now it's shots and pills. It's unbelievable. With the side effects are minimal. It's just a foggier than I used to be, and more tired than I used to be. But, the fact that you can do it through pills that are sent to your house and then going to the doctor's office once a week for shots is incredible. But before they put you on any of those medications, you have to do a urine analysis, you have to do the bone marrow biopsy, you have to do a PET scan. Trying to think, I'm sure I'm missing a few steps along the way, but you have to go through all the hoops. And then I recently did the stem cell retrieval, because after 6 months of the DRVD treatment, I was in full remission. So that was amazing. But before they would do the stem cell retrieval, I had to again go and do another bone marrow biopsy and another urine analysis and a cardiac workup and breathing tests and all sorts of fun tests that I most recently did. But I have that behind me now too.
Erin, you had mentioned earlier about someone with smoldering that you have spoken to on a regular basis, and they progressed and they felt relief. And Brooke, you've lived this. I semi-did when, the doctor walked in 2021 and said it's time to start treatment. And I wasn't ready for that. Like mentally, like I thought prior to that I would be ready when that happened. But when she walked in and said that, even after that appointment, I mean, through the next few days and weeks, and as we did the 6-week tests, I looked back and I said, I was not ready for this mentally. Did you feel like you were ready mentally? Did you feel relief? Were there things that you wish you would have done to be ready?
For me, it was similar to when I first got the call that something was up and that I had smoldering myeloma, and the doctor told me over the phone, and I almost drove into a tree. Yeah, definitely. I wasn't ready then, and I wasn't ready when I progressed in December. The only thing I can say is that the mental health piece is way more important than I think a lot of people realize. Last year, I had an extremely stressful family situation going on that was stress that I never thought I would have to experience, and my numbers went up. So I don't know if it's one caused the other, and I would never say that out loud to anybody within my family, but it's just take care of your mental health because your numbers can change, and stress does play a role. Find what works for you, and whether it's yoga or bitching to a friend or whatever you need to do, but try to find what is the best relief for you so that you're not getting so stressed out in your regular life that it then affects your health. And I was doing as good a job as I possibly could of keeping my stress to those situations at a minimum, but life is life, and sometimes it gets a little ahead of you. But no, I wasn't prepared, and I had nobody with me because, I'd been doing this for every quarter for 14 years. And then all of a sudden it was like, all through all of this, especially for those of us with smoldering myeloma, so much of it, I feel like, is up to the patient. And you really do have to work on your gut reactions and your sense of what you should and shouldn't do, because never was it said, you don't have a choice, you have to start treatment. It was always my choice. And that's terrifying because they're like, well, you should start treatment. Okay, well, I should start treatment. But that's, they make it seem like it's a hop, skip, and a jump. And it's not, and it's a mental thing you have to go through, but you just keep all the information and keep your wits about you and try to make the best decisions. And I hope that I did. I mean, it was my choice not to do the transplant. I had one doctor say I should and one doctor say I didn't need to. So ultimately, it was up to me as to whether I did it or not. And time will tell if that was the right choice. But I made the best choice that I could make for me with the situation that I was in at the time. And you just have to give yourself grace and accept the choices that you make and not beat yourself up. I mean, I can't do anything about it. I mean, I still could have to do one in 6 months, but at the moment, I made the best choice for myself that I thought at the time.
I do speak with people who express that they don't feel like they have a choice. So for any of those listeners, if there are those who feel like I don't have a choice, my doctor is telling me what to do, the way that I navigate them is to empower them to ask questions again, because if they understand where the doctor is coming from with a treatment choice, because there's so many great treatment options so far in so many years, but if they do understand why the particular treatment is being prescribed for them, I sense that they feel more empowered. So I just wanted to mention that.
I agree. And I just will add to that also when you're having these conversations with your oncologist and especially with the specialist, obviously they specialize in myeloma, so they should be asking an array of questions, but let them know your lifestyle. Let them know your home life situation. Let them know if you're going through a stressful divorce or if a family member just passed away or whatever, because when I went to Dana-Farber in January to discuss treatment, the protocol was 25 milligrams of Revlimid. But because I had progressed so very slowly over 14 years and still had no true symptoms. I mean, I had some rib pain that they don't, and I've had migraines my entire life. So whether those are associated with the myeloma, you'll get 10 different opinions on that. But by letting my doctor know, the way I'd reacted to steroids in the past and, my personal situation at home, he was able to curtail my treatment to fit me. And he decided to start sort of low and slow. And instead of doing the normal 25 milligrams of Revlimid every day, I did 10 milligrams of Revlimid every day and had great results. Just keep talking to your doctor and keep advocating for yourself, because thanks to the MMRF and all of the amazing doctors and major centers, there are so many options, and it's not a one-stop shop. And you can question a doctor. They're not going to break, and they will listen. If they're the right doctor, they'll listen and do what works best for you.
And Jesse, for you?
I think the patient advocacy organizations like the MMRF, the IMF, I think they have great resources available. I've been fortunate to be on a patient advocacy team attending ASH the last 3 years, attending those sessions and blogging about those. I even go back and I look at my blogs and then follow up with some of the research that I've been exposed to there. I also work at a university, so I have access to like PubMed and things like that. So I'll do searches on my own, and I have access typically, to articles. And I'm not a doctor, so I can't understand everything, but I have a PhD, so I feel like I can, kind of work my way through some of those articles. And so I try to do that to stay on top of things too. And then I think, Brooke mentioned this earlier, about not being all consumed with it. So I try to take breaks too, and just, like times where I just don't even, try to think about it at all, I try to focus on my health and wellness instead. But yeah, I think the MMRF and, other patient advocacy organizations, wonderful resources available online, as well as numbers, nurse navigator, support numbers to call. I think those are great places to get information as well.
So in summary, there are really some wonderful resources out there. The MMRF has wonderful educational resources. We interview experts. We have webinars, but there's also other organizations that we're happy as nurse navigators to navigate people towards. There's support groups, mentor programs, advocacy groups, and we encourage everybody to reach out and try to make sure that your sources that you're gathering are really accurate. Stay away from the Google. Google is not a doctor, and there's some scary information on there, some outdated information on there. So we really encourage navigation towards really accurate, up-to-date, wonderful resources. There's so many out there. Have either of you made any lifestyle changes since your diagnosis? We sort of alluded to this already with the wellness and the mental health. Really paying attention to your self-care and balance between too much information. But is there anything else that you'd like to add for our listeners?
I think, in the smoldering space, I think Dr. Urvi Shah from Memorial Sloan Kettering is really doing some wonderful work looking at, I think she calls it modifiable risk factors. And she's basically looking at diet, quality of diet, impacting the gut microbiome. And she has a recommendation that people should eat 30 different types of plant-based foods every week. So, you might think, I eat a lot of vegetables. I have broccoli every night, but that's like only one kind. And so she's doing some research that looks at, the diversity and how that impacts your gut microbiome and immune system. And also, is it tied to progression of smoldering myeloma to active myeloma? And so, I've changed my diet. I'm exercising more. I'm really focused on just trying to be as healthy as I can be, physically, mentally, spiritually, socially. That, those are the things that are important. And, Brooke brought up stress. And, I think that, doing whatever you can to reduce stress is really important too. And so for me, that has kind of manifested in having a new outlook on life, in terms of I'm 59 years old, moving into, the last third of my life, hopefully. How do I want to live this? And how do I approach it sort of wholeheartedly? I like this term, like wholehearted and, being real. And so yeah.
I agree. What you eat makes a huge difference. And I don't drink sodas anymore. I try to minimize a lot of red meat. I try to make sure that I have protein in my diet, and I have different vegetables and fruits and protein powders, and just try to take care of. And the gut biome is huge. And that's a whole nother realm that is just kind of now, I feel like, coming to the forefront of how important it is to your gut health is to your overall health. And so anything you can do to improve that, I think, and just as I alluded to earlier, just by a cleaner life, I mean, not only nutritionally, but I got rid of all the plastic in my house. Most of my stuff is glass. All of my Tupperware is glass now, and just trying to do what I can to minimize the effects that all the toxins in the world have on our daily lives. I've tried to change toilet papers without bleach. I mean, just anything I can do to try to improve what I put my body through, so that hopefully it can fight this off for a long time into the future.
We know that having a caregiver is a very important part of active myeloma patients' team, especially to help during the treatments a patient receives. But how important is it for individuals with smoldering myeloma to have a caregiver? And do caregivers really have a role? Jesse, who helps you out, and what specific things do you need help with if you do see a need for a caregiver at this time?
Yeah, I think my biggest supporter is my wife, Karen. And so, I think, her primary support for me is emotional and mental, and helping me, knowing that I'm trying to make the changes in my life, that I've talked about, trying to, be as healthy as possible, physically, mentally, emotionally, spiritually. She becomes kind of a guidepost for me to help me kind of check that. And she's assisted, at appointments as well. She doesn't come, to a lot of my appointments, but she comes to some of them. And then she's there as that, support and that person to lend another perspective too.
And Brooke, what about you? Do you have a caregiver?
I do not have a caregiver. I take care of myself for the most part. I've been divorced for 12 years now, but I have amazing friends, and a few of them have sort of taken on the role of caregiver, and I try to divvy it up so that I'm not burdening anybody in particular. I had a friend of mine was with me the whole time I did my stem cell retrieval last week, which was mandatory. I mean, not only would they not let you leave under your own guise anyway, but emotionally is really necessary, even if you don't have a spouse or a loved one that can go to appointments or to things like stem cell retrievals. Find a friend, or I'm sure that, through support groups, if you don't have that as an option, I'm sure that there are options within that as well to give you support. But definitely anything you can do to just keep it so that you can focus on being the patient and not having to digest everything. I have to say that being single, make sure your doctor knows your home life situation, because that has played a relatively big role in my protocols along the years, because I didn't have the support system necessarily at home. And that's okay. It's not horrible. And as I said, I have amazing friends, but you don't want to burn anybody out. So it makes it a little bit tricky. But, as long as the doctors know what's going on, they can adjust your protocol to follow suit with what works best for you.
So a caregiver could really look like anything. It doesn't necessarily have to be a spouse. It can be friends.
I have 4-legged caregivers that take very good care of me. I wish that they could come to doctor's appointments with me. I should have them be support animals at this point.
Were there any family members that you know of that had smoldering myeloma or multiple myeloma when you learned about this?
Not really. When I was first diagnosed 14 years ago, no one in my family had cancer of any type. We had heart conditions, but we didn't have cancer. Since then, as I mentioned, my ex-husband was diagnosed with multiple myeloma with lesions back in March. And so we seem to think that it's more environmental for us than familial.
Okay. What about you, Jesse?
No family history or current status of any plasma cell disorder.
Brooke and Jesse, thanks again for taking the time to share your experiences with me and for all the listeners. Your stories really bring to life what it is like to live with smoldering myeloma and will be very helpful to others who find themselves with a similar diagnosis. My best wishes to you both as you continue on your journeys.
Thank you for listening to this episode of the Myeloma Matters podcast on smoldering myeloma, hosted by the Multiple Myeloma Research Foundation. The MMRF thanks Jesse Dahl and Brooke Roberts for sharing their unique perspective and insights on what to expect after a diagnosis of smoldering multiple myeloma. The MMRF also thanks AbbVie, Cure, Genentech, GSK, Johnson & Johnson, Karyopharm, Pfizer, Regeneron, and Sanofi for their generous support of this podcast. If you have additional questions about what you heard today, call the MMRF Patient Navigation Center at 1-888-841-6673. If you've enjoyed this series, please be sure to leave a comment or review wherever you get your podcasts.